my pleasure to welcome you all to this extremely important and critical interaction of the Honorable Minister of Health and Family Welfare, Government of India, and the Regional Director of WHO Southeast Asia region.
So was to identify the geographical areas where the COVID clusters are, where are the hotspots, and then within the hotspots, the key is to microplan. If we have a good starting base, if we have a good microplan that recognizes the local constraints and the local challenges, and then identifies the ways to overcome them, and again using the polio experience, and then training. It's very important that the health workers who are going to support the containment activities are trained prior to initiation of the activity. So those are critical activities. In addition to that, as Dr.
Concentrate important and critical interaction. Good afternoon, everybody. On behalf of the Regional Office of WHO
these case investigation forms are fully filled. Additionally, the medical ensure that they are tested for COVID-19. And
Good afternoon, everybody. On behalf of the Regional Office of WHO Southeast Asia region, it is my pleasure to welcome you all to this extremely important and critical interaction of the Honorable Minister of Health and Family Welfare, Government of India, and the Regional Director of WHO Southeast Asia region with the field staff of WHO in India on the COVID-19 surveillance and containment activities. We understand that a lot of people have joined this interaction, and the participants include, of course, the Honorable Health Minister, Government of India, Dr. Harshvardhan, the Honorable Minister of State for Health and Family Welfare, Shri Ashwini Kumar Chaubey, the Regional Director of WHO Southeast Asia Regional Office, Dr. Poonam Khetarpal Singh, senior officials from the Ministry of Health, from the NCDC, from Indian Council of Medical Research, the IDSP, the State Health Secretaries, and the medical officers of WHO India that are involved with immunization, surveillance, tuberculosis elimination and neglected tropical disease elimination, and hypertension control initiative in the field. During this critical intervention that we're going to have over the next 1.5 hours, we'll be looking at the engagement of the field staff of WHO for strengthening COVID-19 surveillance and implementation of the IDSP platform. We'll also be looking at the experiences of strategies from the some states of India, on how this collaboration is already working. And then finally, we'll be looking at how this can be further strengthened so that there is benefit to the COVID-19 containment activities in the country. So with those words, I will turn over to Dr. Sujit Singh and welcome Dr. Sujit Singh, the Director NCDC, to give his welcome remarks on behalf of the Ministry of Health and Family Welfare. Over to you, Dr. Sujit.
Thank you, Dr. Fareed. Our respected Minister, Dr. Harshvardhan Sahab, Minister of Health and Family Welfare, Government of India, Minister of State, Shri Ashwini Kumar Chaubey, respected Special Secretary Sahab, Shri Sanjeev Kumar Ji, our Principal Health Secretaries from the states of Bihar, Karnataka and Maharashtra who have joined through VC, Regional Director of WHO, Dr. Poonam Khetarpal Singh, WR India, Dr. Hank Vakadam, Dr. Ramesh, Dr. Pankaj, and all other dignitaries who have joined either on VC or in person. I welcome you all on behalf of Ministry of Health and Family Welfare to this important interaction which our Honorable Health Minister has kindly consented to take the lead so that the fight which is going on in the field can be directly collaborated not only with the Ministry of Health officials but bringing together WHO, field staff, SMOs, TB level officers and others who are giving important contributions in the field. So at the outset, I'd like to highlight that this particular initiative which has been undertaken by the Ministry as a proactive measure prior to even declaration of a public health emergency of international concern by WHO has been spearheaded by our Honorable Minister, our Secretary Madam, and our important dignitaries who are working day and night since last, now it is over 3.5 months. So I think this is the time when we need to look back and we need to strengthen our collaboration further. Here, it is more pertinent to mention that we have come this long way just because we had very able leader leading from the front and leading right into the field. Wherever we needed his help, he has always been there to guide us and also to support us, not only with regard to the initiatives which are taken in the field, but also take it up to the various ministries, through group of ministers, through even to the highest level of the country, and we have been able to get the immense support of our Honorable Prime Minister Ji, who has not only agreed or who has directed, given additional support by giving us the lockdown period, which will help us or which is helping us in a big way to contain the community transmission. I think all of you are well aware that in containment of this disease, there are two important steps. Number one, the infected persons who are there in the community have to be properly either quarantined or isolated. So we have to bring all the infected persons who are in the community to either hospitals or to quarantine facilities so that they do not spread the infection further. Second and most important aspect is to disrupt or to interrupt the community chain of transmission. And in this endeavor, our Honorable Prime Minister Sir has given us a big support by way of not only giving us the first lockdown but extending it further to the second lockdown period, which is very, very crucial. And as our Honorable Minister has mentioned rightly, that first 7 days of this particular lockdown period are the test of the time. We have to come and we have to struggle and we have to deliver. I think these are important things which have to be carried on field. Lot of things have gone into, lot of technical guidelines have gone into, lot of preparedness, not only with regard to capacity building, increasing the capacity of the laboratories, increasing the capacity of the various kind of manpower has already gone into it. Now is the time for action. Now is the time when we need to focus on our field level functionaries and how best we can use the available resources, available human resources which are there in the field. So in this particular context, today's interaction assumes far more importance than any other initiative which can be talked about, which can be done by way of policies or by way of interventions. Sir, I thank you from my bottom of the heart to just giving us time for this particular initiative, and I also thank WHO for taking this time out and involving these functionaries in a big way. IDSP staff, I must highlight, have been undertaking these surveillance activities in the field for past now over 2.5 months, directly or indirectly by way of supporting the screening passengers which were screened prior to this, and then now again we are directly monitoring the persons in the field by way of contact tracing, by way of strengthening the community surveillance. Now it is the time that all the field functionaries have to come together, because we are observing not only the hotspots which are emerging in various districts, but also some big clusters have emerged. This cluster containment and containment of the hotspots is the key for interrupting our transmission, so that the rate at which we are increasing, although it is substantially fairly good as compared to many other countries which are developed or developing in various parts of the world, but to bridge this last mile which is required at this moment, we require support from all corners. All health functionaries, government, non-government, WHO, international, have to come together for this greater cause of public health, at least as far as our country's population is concerned. So sir, I will like to again welcome our field staff, IDSP staff, state level functionaries who are there in the field and who have joined through BC, district surveillance units. I think primarily we are focusing on the states of Uttar Pradesh, Maharashtra, Jammu and Kashmir, Bihar, and we are also focusing on Karnataka. These are the prime things, but again, as I have been told, that over 1,000 persons have already joined, sir, already logged in through BC at various levels. Even our central surveillance officers who are there, who are directly interacting in the field, are online in this particular communication. So in the initial part, what we will be going through is, we will be be having a small presentation from WHO and also from the ministry side, which will be highlighting that how this collaboration is helping us. I must underline here, sir, that WHO officers in the state of Uttar Pradesh, Bihar, they are already helping us there by way of filling the case investigation forms and also helping us in the containment strategies. But now we want their technical expertise to help us in preparation of the micro plans which are there. The strategies have been rolled out. The micro plan has been very meticulously designed, but as you all are aware, sir, that micro plan has to be adopted to the local situations. We are having clusters right from Ladakh up to down south. Every situation, every state is different, and topography of every state is also different. We need to adopt this our micro plan to suit best to the state level situations, and this is the type of technical expertise which we are looking at the help from WHO. They know the ground, they have been working in the field, and they will be the ones who will be helping us that how this micro plan implementation, ward by ward, community by community, they're taking it down to the ASHA level workers, multi-purpose workers who are working in the field. So sir, this is one important aspect. Second important aspect in which they are already helping is the case investigation form, so that we can go to the route of transmission which is happening in the community. If we are able to identify the route of the transmission, we are able to further strengthen the lockdown impact which is having on this one. So sir, I will just like to highlight 2-3 main points which are there, in which the collaboration can be increased. Number one, technical collaboration between the field level staff. Second is the supervision and monitoring, because independent supervision through WHO staff will give us additional information that where our implementation is required to be further strengthened. That is another. Last important point which I would like to highlight here is that as we progress further, there will be districts which will be taking benefit out of this and which will be becoming free in a gradual stepwise manner. During that time, we need to continue our surveillance in a rather more aggressive manner, so that any further entry of the infection into that particular district is tackled in the best possible way. So, tackling infection through an enhanced surveillance will be another aspect where we will be looking at the enhanced collaboration between the district surveillance unit of IDSP and the field level staff of the WHO. So sir, with these words, I again welcome you all and welcome to all the dignitaries who have joined through VC to this important interaction. I will be requesting Dr. Hank,
reminding us that we have to look at mechanisms to strengthen the collaboration. It is time for all of us to look for action with the available resources that we have. And with that in mind, I will turn over to Dr. Hank Bekadam and Dr. Pankaj Bhatnagar to give us a sense of the WHO field staff engagement for strengthening the COVID-19 surveillance and the implementation of the IDSP IHIP. Over to you, Dr. Hank Bekadam.
Thank you very much, Sunil. Honourable Minister Rashidhan, also the Minister of State. I would also like to recognize the Special Secretary Sanjeeva Kumar, Dr. Sujit Singh, other senior officials, both in Delhi but also especially in the state, our regional director and the team over here. First of all, I would like to thank the Minister and the regional director for having this video conference meeting. It's about reviewing and supporting the field team and further strengthening their field operation. And Minister, I think you worked with this team. You worked with the team when we were fighting polio. The field team was key in the fight against polio, and this team is now also ready for the fight against the COVID. And to thank you so much for having this opportunity to share with you the team itself, what it has been doing so far, and sharing some ideas and listening to your vision from how to move forward, together with the vision of the regional director. This is of course also in addition to our support at the central level, the ministry, but also very important institutions like the ICMR and NITI, etc. So there is one thing for sure, Minister, what already happened is that we have been working for some time already in supporting the COVID. When the COVID started, I think just like the ministry in India was very quick in responding, we are very proud that we started repurposing our stuff already in the field and at the central level in the 3rd week of January. We also got very clear requests from the ministry in a few areas to start at least expanding the IDSP using the Integrated Health Information Platform for the whole country to make sure that these things are done by the end of April, but also helping with the case investigation forms related to the COVID, which I think is very important, because I think it is important that we need to know all the details. But also, you asked our support in the readiness and assessment of the COVID hospitals. Next slide, please. Minister, as you know, we have quite a team out over there. And the team that you're most familiar with is the team, the polio team. Previously it was called the NPSP, the NPS polio team, and now it's called the Public Health Surveillance Program. And there are more than 200 doctors over there, but they also work with field monitors. And the field monitors, they are in several states in a big way, especially Bihar, UP, but also Maharashtra, but also some other states. But we have also other teams that you're also very familiar with. Is people are working on tuberculosis, on neglected tropical diseases, and also people are working on the hypertension, and some people work in the health system. Now, Minister, this team is ready, and I think with the vision, but also the Secretary that I've also said, they have been repurposed, they are there to support the fight against the COVID. Minister, if you don't mind, I would like now to give the word to Dr. Pankaj Bataga. He is the acting team leader of the NPSP, and he's overseeing the field work and the support.
Thank you, WR.
Dr. Pankaj.
Thank you, WR. Sir, as Dr. Sujit Singh mentioned, the WHO medical officers are presently supporting the IDSP surveillance officers in collecting the additional epidemiological information on the case investigation form. As you know that this additional information on the revised case investigation form is key to further guiding actions. In addition to that, they are also helping to build the capacity so that in the future these case investigation forms are fully filled. Additionally, the medical officers are also working with the health facilities to intensify surveillance, and this is particularly with regard to the influenza-like illness and the severe acute respiratory cases, and they are following up with the health facilities to ensure that they are tested for COVID-19. And in the states where we have had field monitors, they have been supporting the contact tracing. Also, based on the data, and in future we will be using from the data whatever forecasts are there to identify what are the operational needs and the resource planning based on the modeling. The analysis of data for action is very critical, and sir, as you are aware, during the polio days, the data was used at the state and the district level through the task forces, and that really guided the program on the field. And similarly, the medical officers will work with IDSP to present this data at the state and district level and guide action for COVID. Now, moving on to the next slide on the cluster containment, the teams are working with the rapid response teams at the state and district level. And here the key areas of work, as Dr. Sujit Singh also identified, also was to identify the geographical areas where the COVID clusters are, where are the hotspots, and then within the hotspots, the key is to microplan. If you have a good starting base, if you have a good microplan that recognizes the local constraints and the local challenges, and then identifies the ways to overcome them, and again using the polio experience, and then training. It's very important that the health workers who are going to support the containment activities are trained prior to initiation of the activity. So those are critical activities. In addition to that, as Dr. Singh mentioned, the monitoring of the activity is really key, and the monitoring, as you are aware, sir, has guided the polio program, and real-time feedback was being given to the health facility. So similarly, the field team can play a similar role in this. They are already doing this in some of the states where they have been identifying some of the critical gaps, and they are providing a real-time feedback like we used to do in the evening feedback meetings. And the feedback has allowed for corrective actions. Going on to the data collection, and here again I would like to highlight that the SARI and the ILI cases and their aggregate data from the health facilities which is being collected will further enable us to guide the program, and further the enabling of the CIF collection within the real-time IDSP data platform will be critical. Also the mapping of the clusters and cases on the integrated health information platform will help us to identify where these hotspots are, where is it that we need to take the key actions. And over the course of the next 3 slides, we will just present a snapshot of how the IT systems can guide the program. So if you see here on the integrated health information platform, it clearly shows that we have data from 57 lakh cases which are already on the platform, and this is data which is coming from various states, and this includes the data on the ILI and the SARI cases and also the COVID cases. On the next slide, sir, you can see the ministry's real-time information system. So on one side is the IDSP platform, the HMIS and the IHIP platform, and now they are feeding into the special surveillance system. This is again strengthening of the data using the information systems. And if you go to the next slide, sir, here we can see the hotspots. What you can see on India's map is all the COVID cases, the cases of ILI and the cases of SARI. And further, this, if we were to expand the map, you can further drill down and go into greater depth. And this is very useful for analysis and for micro planning and then following up as things happen. So these data systems are going to play a critical role. And if you go into the next slide, please. So and that's why the accelerated implementation of the integrated health information platform is key. And here WHO officials will play a key role in capacity building of the key state and district health officials on the IDSP module of IHIP. And we are planning that this type of training be completed within the lockdown period of 30th April 2020. With that, I'd like to stop here. Thank you, sir.
Thank you very much, Dr. Hen Pekadam and Dr. Pankaj Bhatnagar, for giving us an overview of how WHO field staff is already engaged with some of the strengthening COVID-19 activities. So, talked about strengthening surveillance and response, talked about cluster containment activities, and you talked about the data collection activities. It will not be out of place now to go to some of the state governments to see how this is actually working. So maybe we should hear from the secretaries from the states, and I'll turn over to Mr. Sanjay Kumar, Principal Secretary Health from Bihar, if he's on the line, to please give us a brief snapshot of how this experience is working, how the collaboration strategies are working in Bihar. Over to you, Dr. Sanjay Kumar, please. Looks like Mr. Sanjay Kumar is still not on the line, so maybe we can come back to him later. We'll move on to the next state. Maybe we can move on to Karnataka. Mr. Javed Akhtar, Additional Chief Secretary, Health and Family Welfare, if you can give us a sense of how the collaboration strategies are working in the state of Karnataka. Over to you, Mr. Javed Akhtar, please.
Yeah, thank you. Honorable Minister, Honorable Minister of State, Shri Sanjeev Kumar, Special Secretary, Shri Surjit Singh, Dr. Surjit Singh, all the distinguished guests here. I will submit a very brief overview of the status of the affairs connected to COVID before you. To start with, as on today, we have had 270 cases, 276 cases in positive cases in Karnataka, and of them 5 have been cured and they have been discharged. So live cases are 201. We had quite a manageable number of, not manageable, quite an okay number of deaths till 2 days ago, but unfortunately 6 deaths have happened in the last 2 days. So our death toll has gone to 11 today. The total number of primary contacts that we have identified so far is 2,568, and the total number of secondary contacts number to 6,373. So we were generally testing about 500 to 700 samples till 3-4 days ago. So now we have given a great push to test larger number of samples. So yesterday we have tested 1450 samples. Of that, 16 have turned out to be positive. So this percentage comes to about 1%. So this is not a bad number. In Karnataka, sir, we have two international airports at Bangalore and Mangaluru, and there are two ports, that is Mangalore and Uttar Kannada. So altogether, 1,39,792 passengers have been screened in Karnataka, and all the international passengers have completed their quarantine period, and 9,770 are still in the reporting period, the second part of the 14 days. So they are in the reporting period. We have started this screening and contact tracing quite early. Generally, the number of countries that were covered for screening at the airports, so we are little ahead of the advisories of the Government of India, because we wanted to maintain abundant caution. So, for instance, we started screening all international passengers 3 days before the Government of India advisory came, and that was after our submission that was made to the Secretary Government of India. So, we have attached a lot of importance to contact tracing and containment measures. I will give an example of Bangalore. In Bangalore, we had at one point of time 500 teams which were doing home quarantining work. They were going to different houses and they were stamping with their hands. So this was happening, one police officer and one Ayush doctor. After this job was completed, then we set up 1,000 surveillance teams to go to each house every day, wherever contacts were living, and monitor the health condition of the quarantine persons. Apart from this, we also had flying squads who were given vehicles. So these flying squads consisted of one police personnel and an Ayush doctor in general. So now, apart from this, we started early mental health counseling to those who are under quarantine. So I can give a figure as on today. Till today, we have completed more than 33,000 sessions. These are broadly the figures. And in Karnataka, from the very beginning, Honorable Chief Minister started giving sometime on a daily basis, but definitely 2 to 3 times in a week. And thereafter, he constituted a task force which was headed by the Honorable Health Minister. This was in fact a cabinet subcommittee consisting of, apart from him, one Deputy Chief Minister and 2 other ministers. Then the Honorable Minister for Education, he is continuing with daily media brief. Chief Secretary has been taking the review on almost daily basis for the last 2 months, and that has really helped to a very large measure in coordinating the war on this COVID. Then apart from that, government has constituted various committees headed by very senior IAS officers to look after, say, containment measure and tracing. One officer, another officer was put in place to identify the places where people should be quarantined. Then there was another to look after the distribution of food grain. Another was look after for different aspects of lockdown, different officers were appointed. Subsequently, on the advice of the Government of India, all these officers were made head of the teams. This individual nodal officer system got converted into team system. So right now we are having more than 10 looking after different aspects of the COVID operations. One or two things that I would like to submit here is that we are really thankful to Honorable Minister and Government of India for helping us in a big way in establishing new testing laboratories. As on today, we are having 12 government laboratories and 5 private laboratories. Taking into account the population of Karnataka, I think this is the highest number anywhere in the country. We are really grateful for this, and that is really helping us in giving a push to the testing that we have decided to do in a very big way. Apart from this, another thing that we started early was establishing fever clinics, because there is a necessity to separate those who are suffering from coronavirus from other patients. So initially we set up at a few places separate OPD facilities in the existing hospitals and health institutions. Subsequently, we established fever clinics in different parts of the country. In Bangalore, as of now, 31 fever clinics are functioning, at least one each in constituency, in MLA constituency. We also, about 2 months ago, we identified the wards across the state which were ready for treating COVID patients. Subsequently, we created a contingency plan, and now this contingency plan is a very comprehensive document where we have identified with some projection how many tentative cases are likely to come and how many will be suffering from, of course, there is a formula 80%, which is expected that 80% of the patients will be suffering from mild and very mild symptoms, 15% from moderate symptoms, and about 5% will suffer from severe symptoms. So taking this into account, we took the worst scenario. When we were preparing the plan at that point of time, the worst suffering was happening in Italy. So we took into account that number. So we took a very bad forecast of getting ourselves prepared to handle about 85,000 patients in the state. So we started with that, and we also thought that we will start triggering this entire action plan with some sort of, because creating infrastructure for all the 87,000 persons at one point of time it is physically impossible, and also a lot of resources are required to be put into this. Therefore, we decided we will have a triggering mechanism. So right now we have triggered, assuming that 20,000 patients will come to our health system. So the breakup will be 16,332 patients suffering from, mild symptoms. They will go to, as per Government of India classification, category A hospitals. Roughly 3,000 will go to category B, and about 1,000 will go to category C of patients. So we have triggered this action plan, and maybe in 2 to 3 days we will have in place facility to handle 20,000 patients. As regards notifying COVID hospitals, we have notified 31 COVID hospitals in the state. The total number of beds in these hospitals is 5,670, and 801 ICU beds are available with 372 ventilators. This is roughly the preparedness to handle the worst scenario. So these are broadly the actions taken by us in the state. Apart from that, we are also trying to leverage the information technology infrastructure which is available in the state. So we are using one app called Quarantine Watch. This is helping us with the help of GPS to locate whether the person who is under quarantine is staying at his notified place or not. Then now we have almost finalized a system, IT-based system of complete population screening. Under this dispensation, what we will do, we will push SMSs to all the telephone holders, all the mobile holders. We will send WhatsApp messages, SMS. We will also blast a lot of emails to all the email account holders in the state and obtain from them their status of the health. And of course, there are three levels there. First level will be managed by nursing students, second level will be managed by Ayush doctors, and the third level will be managed by doctors. So like this, we want to screen the entire population. We expect that this type of facility will be functional in next 3 to 4 days. So these are some of the things that we have tried to do here. Apart from this, we had a complete review of the availability of oxygen production for our worst forecast. We are lucky that there are a lot of companies who are manufacturing medical oxygen in Karnataka. That has also been circulated. So our hospitals across the state are ready to handle patients. So these are some of the things. And coming to WHO support, we are a very very strong and very cooperative WHO team stationed in Karnataka, led by Dr. Ashish Satpathy, and there are other doctors, Dr. Lokesh Alhari and Dr. Nishchit, who are working with us in Bangalore on a regular basis. Apart from that, we have also modified the availability of WHO consultants who are situated in different parts of the state, and we have also requested the Deputy Commissioner to make use of them in their operations, and they are utilizing their services very effectively. The WHO team is giving us technical support in preparation and dissemination of state-specific SOPs, protocol and guidelines. They are doing it very effectively. They are also helping us in capacity building of medical officers and other cadres. At this point of time, I would like to submit that under the aegis of the Rajiv Gandhi Health University, we have prepared a lot of training materials, starting from the health workers to the specialist doctors. There are many of them. So this training program is going on across the state in a very big way. So in this operations of support, the WHO team is helping us. The WHO team has also helped us in contact tracing and the preparation and implementation of the containment plan apart from training. Then one substantive work which is being done by the WHO team is epidemiological data collection through CIF filing that has been mentioned just now. And apart from this, now that our hospitals, dedicated COVID hospitals have been notified, they are in the process of going and assessing the preparedness of these hospitals. So these are some of the services where we are utilizing the expertise of the WHO team. This is broadly the submission from the state of Karnataka, and I am really thankful for giving me this opportunity to make this presentation before you. Thank you, sir.
Thank you very much, Mr. Javed Akhtar, for giving us a comprehensive overview of how things are being managed in Karnataka. The strong political and administrative engagement, the innovative technologies, and the technical support being provided by WHO in the state of Karnataka. Maybe we should now move over to Maharashtra, and may I now invite Dr. Pradeep Kumar Vyas, Principal Secretary Health, or Mr. Anup Kumar Yadav, the Mission Director, National Health Mission, to give us an overview of how things stand in Maharashtra.
Good afternoon, sir. This is Dr. Pradeep Vyas, Principal Secretary Public Health from Mumbai. Honorable Minister, sir, and Madam Poonam Shatpal, Madam, Regional Director, Southeast Asia Region of WHO, Country Representative of India, Dr. Hank Beckedam, and other officers of WHO. First of all, I would like to assure you that though the numbers seem very high as far as the Maharashtra and Mumbai is concerned, but there are some signs of hope and some good offshoots, green shoots may be there. I will just give you an overview of how the things are. See, ma'am, we had, sir, up to last evening, 2,684 positive detected cases, of which we could discharge 259 after full recovery. And active patients right now are about 2247. So roughly 2200 odd positive patients are there in our various health institutions. Of this, about 90% are in only 3 districts, Mumbai, Pune and Thane. Now, in our Thane district, this is maybe one of the very peculiar districts in the country where in a single district there are more than 8 municipal corporations. So it is a highly urbanized population, fragmented, lot of slums are there. So we have a focus, though you may be reading in the media a lot of reports that there is a lot of infection, but let me assure you that the infection is concentrated in these 3 districts, and as of now, as of today, there are 9 districts in Maharashtra where there is not a single active case, and if you take out these 3 districts, then rest of the districts have only less than 10% of the total active cases in Maharashtra. Ma'am, we are doing this test in a very large number, like we have done more than 47,000 tests, which is one of the highest in the country, and maybe about 20% of the total tests done in the country. Now, against that, our positivity rate is about 5%. So we want to increase it in a way that it is a more targeted approach. So we are adopting some steps so that our positivity rate out of this number of tests increases further. we have fully geared up, we have designed the system in a such a way that what we have done is last 1 week after, see, but there was initially some issue because Government of India instruction in the beginning were to have the COVID designated COVID hospital. Subsequently, we were told to have the 3-tier system. So now 3-tier system of hospitals is in place in each of the district and each of the municipal corporations. And we have tagged it with the fever clinic as well as the non-COVID patients. So we are prepared for the long haul, and some steps have been taken last few days. Basically, we are very concerned about each and every death which is taking place in Maharashtra because of the COVID. Now, one thing I would like to place on record that it is a very, very transparent reporting system, wherein in several cases, even when the report came subsequent to the death, but if the swab was taken prior to the death, the case has been included as a death due to COVID. So there are a couple of such instances because of which the number seems to be very high. But over the last 3 days, it is coming slightly down. 3 steps which we have taken is, number one, we have collected all the experts, critical care medicine experts in Mumbai and created a sort of a task force. So these are all renowned names in the critical care and ICU care in Mumbai, working in very renowned hospitals like all these private hospitals in Mumbai, and they are designing some special protocol for us as far as the critical care patients are concerned. They are also taking care of refurbishment or the filling up the gaps as far as this specialized ICUs in our hospitals are concerned. At the same time, they have volunteered to be on rotational hotline sort of duties. So like suppose on Monday, Dr. A will be available, on Tuesdays another doctor would be available, and we have given their numbers and email IDs to our field staff. So in case of any emergency, they are very dexterously they have offered their help, and their expertise probably will help us. Second committee which we have constituted is that each and every case of death in Pune is being looked into with a set of all the death papers, case papers, and what steps we probably could have taken in a better way that would be taken care of. And similarly, one committee has been constituted for the Mumbai, and they have all the private health experts as well as the retired officers from the public health sector. Here I would like to make one observation which I made to the Government of India team which is here, RRT, that we find a very distinct case development as far as the people who have come from the Gulf, Dubai, and the people who have come back from the US or the Europe. Like we had a first case in our state on 9th of March. The group who traveled to Dubai, there were 40 of them. 3 were from other than Maharashtra, 37 were from Maharashtra. So all of them recovered without a hiccup, and all these people who came from Dubai, we had having no problem. The persons who came from the after Hajj or the travel history to Iran or those places, absolutely no problem. But the people who have returned, particularly the IT professionals who were working in some countries in the Europe and the USA, we are finding a lot of problems and a lot of complications are developing in their cases. So that is the one observation I was sharing, that whether it is a different strain which is there, because they are very, very distinct. So it is not the issue, because many people may be saying that it may be something to do with the case management, that why in Mumbai, in spite of such a high quality of medical infrastructure, you have such a high death rate. But there seems to be some issue in some cases, but we are grappling with it, and probably we will come over this particular thing. One particular issue I will like again a help of WHO, because you were mentioning in the presentation about this mathematical modeling. Because when we are asked to make preparation for future, we must have some idea that what would be our likely peak number. Now, we keep hearing that we would have a peak in sometime in the third week of May or around that time. But what it would be? So we have assigned some number, because we have to make ready some beds. So like say right now my active case number is say suppose 2200. So I am roughly about 20 cases per million, and this is my load or active case load in the state. But I should prepare for the peak case load of how much? Because that is not, nobody is willing to, but I have no idea. So on my own, what I have done in my state is that we have taken a peak load of say 300 per million active cases at one point of time somewhere in the month of May. And what we are doing is that we will do this categorization in say 40%, 30%, 30%, meaning that 40% of this 300, so that is roughly say about 120 cases per million, I would be geared up in about 3 days time or 4 days time. So even if I am right now at 20, but my capacity in next 3 days time is 120. So I can reach immediately 120 if the situation so warrants. And then if suppose that I get that many number, then I will further escalate. Escalate means I will activate those facilities. But if some help could be given to me in form of modeling that what number I am likely to achieve, reach in the, as a peak number, then probably it would help. As far as the role of the WHO is concerned, we are very comfortable, we appreciate, and they are very helpful. They have provided us the training in our field frontline health workers, infection control, how to fill up the forms, do the SARI surveillance, and then containment policies and RRTs are working. And we have no problem, we are working in a very good coordination, and many of the people right now in the team in the Maharashtra, they are working with us for a long time, so we have good rapport. So no issues as far as the WHO is concerned, they are really a great asset. My only request would be if I could be told this peak number which I am likely to reach so that I can plan better. Thank you.
Thank you very much, Dr. Pradeep Kumar Vyas, Principal Secretary, Health, Government of Maharashtra, for mentioning that there are targeted strategies that are being adopted in some areas because most of your cases are clustered in just 3 areas. There was an interesting observation that you talked about that requires a deeper analysis. So thank you very much for those comments. We have Mr. Sanjay Kumar back online, Principal Secretary Health from Bihar. So over to you, Mr. Sanjay Kumar, for your comments, please. Mr. Sanjay Kumar, can you hear us? Yeah, he's there. We can see you, Mr. So, yeah, but we saw him briefly.
Finding it difficult to connect.
Can you put your speakerphone on so that you can speak?
Yeah, we can hear you. Dr. Subramaniam, we can hear you. If Mr. Sanjay Kumar is there, he can. Okay. Yeah, he's there. Mr. Sanjay Kumar.
Yes, sir. Yes, do you wish to speak, sir? Yes, sir. What's wrong, sir?
Can you put your side low?
Yes, sir.
Yes, sir. Yes.
Can you see me? Yes, sir.
We can hear you. Yes, we can. Sorry.
Facing and connecting with Bihar. So maybe we can move on and see if we can come back later to Bihar. So we've already got a good overview of the situation in Bihar, in Karnataka and Maharashtra, and how the state governments are engaging already, collaborating with WHO. So I think it will be appropriate for us to hear from our regional director from WHO Southeast Asia region on the regional perspective on how she's looking at these things. Over to you, Madam Dr. Poonam Khetrapal Singh, please.
Thank you very much, Sunil. Honorable Minister of Health and Family Welfare, Dr. Harshvardhan Ji, Honorable Minister of State for Health and Family Welfare, Mr. Ashwini Kumar Chaubey Ji, Special Secretary Health, Mr. Sanjeeva Kumar, State Health Secretaries from Bihar, Maharashtra and Karnataka, senior officials from the Ministry of Health and from NPSP, officials from NCDC, ICMR and IDSP, a very good afternoon to all of you. At the outset, I would like to thank His Excellency, the Minister of Health and Family Welfare, Dr. Harshvardhan Ji, for convening this meeting. We are all aware that we are going through a very difficult time. In fact, the whole world is passing through a very difficult time because of COVID-19. If you look at this slide, you see the cases that the world has today, which is nearing 2 million. And then when you turn to the region, it has more than 20,000 confirmed cases and about over 900 deaths. The spread of COVID-19 in the Southeast Asia region, thankfully, so far, has been relatively slow when we compare it to other parts of the world. And this is perhaps because they have adopted physical distancing measures very early on. We are relatively well positioned, therefore. For more than 2 months, we did well to contain the virus to 1,000 lab confirmed cases in WHO Southeast Asia region. However, this curve rose steeply thereafter and reached 5,000 cases on the 1st of April, that is within 10 days. The cases got doubled to 10,000 cases in another 7 days and then doubled again to 20,000 cases in another 6 days' time only. In the 10 countries that are most affected by COVID-19 worldwide, the mortality rate has ranged from 12.8% in Italy to 2.5% in Germany. In our region, mortality rate ranges from 9% in Indonesia to 1.6% in Thailand. At this stage, the variance is primarily due to insufficient testing rather than a lack of treatment. As we have seen, countries in the region acted early and aggressively and are now planning for the next phase of response. We are fully mindful that physical distancing is important, but physical distancing alone will not achieve the goals which are laid out in the national action plans and is unsustainable long term. WHO has recently published a COVID-19 strategy update that outlines the key measures that countries must implement to slow and to reduce transmission, and how countries can calibrate these measures to their capacity and to their local contexts, with the aim of reaching or maintaining a steady state of low level or no transmission at all. At the core of the strategy are the public health measures, which include finding, testing, isolating cases, and then quarantining the contacts. But the document that WHO has brought out is not prescriptive at all, and nor should it be. Each country has unique resources it can draw on, and therefore each country has to work with those resources. India, being a large country, has its unique challenges to fight COVID-19. However, India also has the capacity to overcome the biggest of challenges and barriers once it decides to achieve something. And there cannot be a better example of this than the achievement of polio elimination in India in 2014. Many of you may be aware that the Honorable Health Minister Dr. Harshvardhanji was the one who conceived and masterminded the first ever polio vaccination campaign which was conducted in the country. It was under his leadership that a mass polio vaccination campaign was conducted in Delhi on the 2nd of October 1994 when he was the Health Minister of Delhi. The movement that he started in Delhi in 1994 spread to the entire country, and the result is there for all of us to see that India could eliminate polio. The world was skeptical that a disease like polio could be eradicated from a country like India, and yet with a systematic and scientific approach, India did that. And while the national and state governments play a major role in this achievement, the contribution and the role of NPSP cannot be forgotten. Established by WHO in 1997, the NPSP played a critical role in strengthening surveillance for polio that generated useful, timely and accurate data to guide policies, strategies and interventions until transmission of polio was interrupted in the country. We and the entire world are indeed very proud of your contributions. I also know that 50 NPSP staff had gone to Africa in 2014 when Ebola had spread in that region, and your contribution was critical to control the Ebola outbreak there. Similarly, I am aware of the useful contributions being made by the field staff of WHO that are involved with the elimination of TB, the other neglected tropical diseases, as well as the hypertension control initiative. Dear staff in the field, this is the time to get up again and take on this new challenge that has emerged. In the fight against COVID-19, we have entered a stage where surveillance is going to play a pivotal role in making future strategies for containment. All countries will have to strengthen surveillance for COVID-19 to contain the disease. This will be critical for better forecasting and for better decision making for an effective response to COVID-19. You have the experience, you have the knowledge, you have the skills. It is time to put all this together for the cause of humanity. There are many ways in which you can contribute. Dealing with surveillance and data has been your core strength. Please put that to use now for a cause. The kind of rigor and discipline that you showed while you monitored polio activities, use that to support districts with contact tracing and with containment activities. You played a main role in supporting the district administration during polio elimination efforts that helped the district machinery to respond to local situations and challenges. Use those skills now for COVID-19. My WHO India team will work with the Ministry of Health and Family Welfare officials to finalize the key areas in which you can contribute based on your strengths and your capacities. I urge you to work closely with and under the overall guidance of the state and district governments to support them with COVID-related activities within the framework that is defined for your work. We must ensure a close collaboration and coordination with NCDC, with IDSP and ICMR so that we are supplementing each other's efforts as we fight this battle against COVID-19. I also urge you to make agility a hallmark of the response, with states continuing to share information so that they can learn from one another. In the coming weeks and months, each state will experience varying levels of transmission, and will need to calibrate their response. The rapid sharing of information will help them to adopt the best response based on the resources that they have access to. The Country Office of WHO India will continue to facilitate the sharing of best practices based on transmission scenarios and local capacities. The Southeast Asia Regional Office will continue to provide the broader framework in which these practices should be applied based on regional and global experiences and knowledge. I'm sure the state and district officials will welcome your support. The perseverance and dedication that you showed for polio elimination is required again, and I have no doubt that you will live up to the expectations and make a difference. Before I conclude, I want to remind you all that disease outbreaks can negatively impact progress in a range of areas, from maternal and child mortality to vaccine-preventable diseases and other treatable conditions. India had been making stupendous progress in these areas, and we cannot afford for India's remarkable progress to be set back or reversed. With that, I thank Your Excellency once again for this meeting and eagerly look forward to seeing progress in India in controlling the disease through the collective efforts of all of us. Thank you once again.
Thank you very much. Words. We remember in the fight against COVID, we have entered a stage where surveillance is going to play a pivotal role, making strategies for containment, for better forecasting and for decision making, and that we have to demonstrate agility if we have to work together with all the agencies that are involved with this fight against COVID. So thank you very much, Madam, again for your words. It's now time to move on to the Honorable Health Minister of India.
Dr. Sunil, I have joined. Dr. Sunil, I have joined. I am Sanjay, Principal Secretary, Health, Bihar. There was a bit of a technical hitch in the beginning, so I don't know if I can join in or maybe we can continue.
So, okay.
Minister of Health and Family Affairs, Dr. Harshvardhan ji, Honorable Minister of State, Shri Ashwini Chaubey ji, Regional Director CRO, Dr. Poonam Khetpal Singh ji, and all my colleagues. At the outset, I would want to thank WHO that you've always been a great partner with us. And I remember in the late 90s and maybe early 2000s when we were collectors and we were fighting this battle against polio. You were one of our constant companions and giving us technical support as well as through NPSP, the kind of monitoring we were doing for polio cases, especially the AFPs. These are difficult times, sir, and we really don't know what we are staring into. And one day you feel better, and one day again you feel not so. Bihar has had till this morning 70 cases of COVID, and out of this 70, 46 of them are from 4 districts, and the other districts, which are 7, they have reported delays. So out of 38 districts, 11 districts have reported. 27 districts still now have had no cases. Out of this 70, we've not been able to trace the infection trail in 9 cases. And this basically comes from 2 districts. One is Begusarai, where I've had 8 cases, but out of that 8, for 6 we have not been able to trace the infection trail. And Nevada has had 3 cases. There also we are finding ourselves in a similar position. Siwan, which is a district which has had the maximum number of cases of 29, but each and every case can be traced either coming from a foreign country or coming in contact with a COVID positive. Initially, our aim was that we would screen all the patients who were coming, all the people who were coming from a foreign country. And we started doing it with the help of WHO, which helped us to create these screening facilities at Patna and Gaya airport. And in the month of March, we nearly screened 22,000 people who came in primarily from the Gulf. There were two difficulties we faced at that particular time. One was that many of these people were actually coming on a combined PNR from the Middle East. So whoever was coming for a combined PNR, we would know that these are the people from Middle East. But many of them would break journey in Delhi, Mumbai, elsewhere, and come into Patna as a domestic passenger. So that was one of the challenges we faced, and we were wanting to, and we did manage to trace, but we may have missed out a few also. Later, we got data from Bureau of Immigration, which said that 22,000 people have come into the state from 1st of March till the 23rd of March. So, depending on that 14-day incubation period, we took a decision that we would screen all the patients, all the passengers who come in post 18th. From 18th March till the 23rd of March, we traced about 2,200 of these people who flew in from the Gulf and elsewhere. And from 15th March onwards, we were actually looking at people who may have had some kind of a symptom. And this actually started the initial trail in Bihar that we started noticing people where till date, our challenge has got its permission, so that is the sixth center in the state, but many of our medical colleges have not done PCR tests in the past, so their daily performance output is about 100 or something. So we are being able to do about 700 tests a day nowadays. So we have done about 8,000 tests, more than 8,000 tests, but the confirmation rate is less than 1%. We're looking at about 0.8 or 0.82% of the people who are actually testing positive. So that's one issue. So sometimes you wonder whether you're missing out on something which is there and actually you're not being able to see. So that's one issue I would want to highlight. 75% of the patients whom we have found COVID positive are actually asymptomatic. So they have absolutely no symptoms. So had we waited for them to develop symptoms, we may have missed out. Day before yesterday, the state, after a fair amount of deliberation, has taken a decision based on our experience of polio, that we are going to do a house-to-house survey to screen people. So the 4 districts which I mentioned, Siwan, Begusarai, Nalanda and Nevada, we are going to do a complete universal door-to-door screening based on the teams and the kind of experience we've had in the polio train. In the other districts, what we are doing is that for each patient who has come COVID positive, assuming it's housed to be the epicenter, we could take a 3-kilometer radius and do a door-to-door screening for all the houses. And for the others, wherever these foreign passengers have come from 1st of March onwards, which is about 22,000 in number, we would go down to their village and cover that village. We're also taking help of the local medicine shops which may be in the area and all the informal and informal service providers in the area. So as we'll be asking them that if anyone has come with any kind of a symptom which would indicate to them in the last 15 days time, and we'll collate all this data to see whether or not we are having symptomatic patients. And if there are symptomatic patients, then we'll get them to a block level quarantine and we'll get them sampled and we'll get them checked through the laboratories. Bihar had anxious moments at the end of March. There are almost about 175,000 people who are migrants who came in from different parts of the country. What we did was that we had their mobile numbers, we had put them in a quarantine or even at the home quarantine, and we did check whether or not they are having any symptoms. We were expecting that probably we would see 1% of people having some kind of symptoms, but actually when we started looking at it, maybe some people may have deliberately not told the truth also. We got less than 0.5% of people who actually had any kinds of symptoms. So this campaign, which I mentioned on the lines of the polio, which we are beginning tomorrow, we do hope that we'll be able to finish it in the next 7 to 8 days. Usually when we had the polio drive, we used to employ 50,000 teams. For this, we are doing about 8,000 or 9,000 So we'll be covering about 16 to 17% of the households in the state, which is a fairly large number. And once it gets rolled out tomorrow, then we will know exactly what kind of a figures we are looking at. And depending on that, we'll be giving you the feedback. We've been receiving adequate technical support from the SMO and his entire team, be it screening at the airport or at the Indo-Nepal, Bihar-Nepal border, and formulating any point of view which requires technical input. So that is there. And once again, I take this opportunity to thank WHO. There is one point which I would want to raise before I close, is that we would want actually a little more clarification on the use of rapid kits, because apparently it does seem that many people, including I think a number of chief ministers who are actually making the introductions during the Honorable Prime Minister's BC, was as if we can use it for mass screening. And so I've been reading what the ICMR guidelines say, and the other technical guidelines are there, and I'm a bit confused, so I would require a fair amount of clarification there as to how effectively or to what extent we can use the rapid kits for screening of people who we may suspect may have the virus. Thank you so much.
Done so in terms of as you were mentioning, a larger survey using rapid test kits. But so far there is no WHO stand on this yet. I can keep following up on this so that there is a clearer guidance. It's uncharted territory, so it's once we have clear guidance from our headquarters, I will send this out.
And Health Minister for India to give his remarks and words of wisdom. Over to you, Dr. Harshvardhan, please.
My colleague in the Health Ministry, sitting next to me, Shri Ashwini Chaube ji, Regional Director of WHO, Dr. Poonam Khetpal Singh ji, our Special Secretary in the Ministry of Health, Shri Sanjeeva ji, Dr. Hank, our country representative, WHO for India, other WHO officials sitting in the regional office, my Director of NCDC, Dr. Sujit Singh, Dr. Ramesh, Dr. Pankaj. Well, all the other health officials, more particularly we had the three health secretaries from Karnataka, Maharashtra and Bihar. And I know that I am joined today by many state government health officials, officials of the national health missions also at many places, over 390 medical officers of WHO working in the field, and also about over 1,000 field monitors. It's a very, very privileged moment for me to be with all of you. I know that we are in troubled times. We are not meeting at a very happy occasion. But I know that time and again the Government of India and WHO together has shown its ability, its competence and its prowess to the whole world. I became a little nostalgic when Dr. Poonam Khetpal Singh ji mentioned and reminded all of us about the polio eradication movement and also about the birth of the National Polio Surveillance Team in 1997. I fondly remember because when we started the polio eradication movement in 1994, we were very strongly supported in Delhi by the World Health Organization. And I would also like to place on record the contribution of Dr. Uton, who used to be in the regional office as the regional director, where we see Dr. Poonam Khetapal Singh today. He is no longer with us in this world. I also want to recall the contribution of Dr. N.K. Shah, the country representative in 1994, who is also not with us in this world today. We have Dr. Hank in his place here in India right now. And I also remember very fondly the contribution of people like Dr. John Andrews in WHO at that time in 1994, and also the contribution of people like Dr. John Rode and Dr. Stephen Atwood in UNICEF. It was a unique movement that we started in 94. And when we started it, people used to mock at us. Nobody in this country, what to talk about the world, could ever think of the fact that India can ever eradicate polio. Even when we started in Delhi, people never believed that we are capable of doing it. But we showed to the whole world that India can do it, like it could eradicate smallpox. 2014 we got the certification. Today itself, when I have all these SMOs and various other surveillance officers of WHO, medical officers working for tuberculosis program and for some of the rare diseases, cardiovascular diseases, etc. I know it's about 400 doctors. Two of them I can see today itself in this program, Dr. Sunil Bahel and Dr. Pankaj. They were amongst the few doctors who were my real warriors in the fight against polio in 1994. And I feel happy that they are still serving in different capacity in WHO and trying to look after many other important issues. I also know that many of the, because in 1997 this organization NPSP was born. In the initial stages there were people like Dr. Kaushik Banerjee who moved to Geneva later on. And in 1999, when I finished my 5 years tenure as health minister in Delhi, I was invited by WHO to work with them as an advisor for the Southeast Asia region. And I remember that with many of you who are the SMOs right now with whom I am talking, I had the privilege to meet many of you, work with many of you in the various districts in Uttar Pradesh and Bihar, which I used to visit as an advisor in WHO. And along with these SMOs, we used to look at those difficult situations, because polio eradication in India also went through a critical phase in the early years of this millennium, when there were so many rumors, so many misinformations, there was so much of resistance in the society from particular sections of the society. But I could see from very close quarters the ability of our doctors, whether in the government of India, whether in the state governments, whether our surveillance officers, whether people in the IDSP, or whether the doctors who were supported by WHO through the National Polio Surveillance Program. And it is because of the combined meticulous work done with so much of commitment sincerity, dedication, that we could ultimately get rid of polio from this country. I can never forget that how desperately our doctors, our surveillance officers, our NPSP staff, you all would desperately search for cases of acute flaccid paralysis. And even if there was an information in the night that there is a case of acute flaccid paralysis, even in the remotest part of the country, our doctors would run to that place to collect stool samples. Immediately there would be a movement to immunize a few thousand children around, and then wait for the results of the stool samples, and if the stools were positive, within 10 days we used to, in fact, what the containment strategies etc. we are talking about today, these hotspots, I think all those places where we had those cases of acute flaccid paralysis, they were the hotspots of the polio eradication movement. And when we used to get a positive result from a stool testing, we used to immunize between 1 to 5 million people around that area. And in a country as difficult as India, as big and as vast as India with 1.35 billion people, where it was said that we were home to 60% of the polio cases of the whole world, we could get the certification from WHO in 2014. So I am happy that Dr. Poonam Khetapal Singh Ji has reminded you about your ability. She has also reminded you about what big things you can all do together. This meeting, for which I had requested the World Health Organization to be convened, was just to remind you about your potential and your ability. You all know that India is amongst the first countries in the whole world to have responded to the news of a coronavirus being diagnosed in China on 7th of January. And in Health Ministry we started working on 8th January itself in our expert group meeting. On 17th January we started our health advisories which we had passed on to the states. We had contacted our embassies in China. We had the list of people who were coming from there. We had our detailed travel advisories with the help of all of you in the field, whether they belong to IDSP or WHO or the state government or the rapid response teams. We started the community surveillance. Today also I feel happy that over 7 lakh people are under community surveillance. Repeated, revised, graded advisories of various nature, whether it was for travel or for other issues. It has been a journey of more than 3 months now. You all know that a lot of things have happened during the course of these 3 months. We got our first case, a medical student, 20-year-old girl, on 30th of January. The second case was on 1st of February. And then we have now come up to 10,000 mark. We are still, our incidence is per million the lowest in the whole world. It ranges between 4 to 8. At different times it has ranged like that. Although for many of these countries it is in few thousands, 2,000, 3,000, 1,000, like that. Right now we are quite well placed in the sense that we know our enemy. We also know where our enemy is. And the talk about these hotspots is, I think I must congratulate our surveillance people, our IDSP people, our WHO people, all those who are involved in this, and particularly all our state governments, that we have been able to pinpoint where the virus is right now. around 400 districts without the virus. And then, of course, the districts which we have called as hotspots, some 150 of them, where we know where we have more than 15 cases, where we know we have less than 15 cases. We also know the districts where we have just about 1, 2, 3 cases. We know the strategy, whether it has to be a major outbreak containment strategy, whether it has to be a cluster containment strategy, what we have to do with the 3 to 5 kilometer diameter. All this, I think, most of you who work in the field, they know far more than me, because you have been working day in and day out about all this. I don't have to tell you about the details of what you are supposed to be doing. I am happy that all the state governments, the state government officials, in collaboration with our IDSP people, our NCDC, our ICMR, our Union Health Ministry, and of course with WHO, they are all working in close coordination with each other, and they are working in a very, very pointed manner. Now, since we know the disease and its location, we know those clusters, we know those hotspots, and we are ably supported by the Government of India in its totality. We are blessed by our Prime Minister, we are blessed by all the other ministries, we are supported by all the officials in the Government of India, all the ministries. The Prime Minister got a group of ministers headed by me with other ministers also, where we had about a dozen meetings till now. So everything is being monitored at the highest level. The Prime Minister has given a big fillip to the movement to handle coronavirus by organizing the Janta curfew, then a lockdown, and then a second edition of the lockdown. So he has been taking the advice of all the experts, our scientists, our clinicians, our epidemiologists, our field staff, with a lot of patience, sincerity, understanding and commitment and vision. So we are lucky to have him there, and we are lucky to have you people, all of you. Since you are there in the field, I feel confident that till now also we have done probably the best in the whole world. In a country as vast as India, we have been able to control things to a very great extent, and I am sure that with your presence and with your abilities, and when you will again, I am sure you are already doing it. This meeting doesn't mean that you are not doing it, but I want all of you to put your heart and soul into this great movement. This is a very, very, I would say, historic in the sense that we have never experienced such a pandemic. At least I have been working in the field of health for over 45 years now, since I became a medical student. I had the privilege to handle plague in 1994 as Delhi's health minister. Also, we never allowed Ebola to enter India in 2014. Last year itself, when Nipah arrived in Kerala, we ensured that it doesn't come out of Kerala. And this has all happened. We have been able to eradicate smallpox, we have been able to eradicate polio, and we have had the guts to dream about eliminating tuberculosis much before the international goal in 2030. We want to do it by 2025. We are working together for elimination of diseases like measles, Kala Azar, and so many other things, and also for working for achieving 100% immunization through various programs and many other things in the health sector. this confidence of ours in the ministry is only because of the presence of, earlier you were, I would say, the polio eradication army or the polio warriors. Today I call all of you the corona warriors. And we know that you as surveillance officers in the field are doing a fantastic job. And similarly, our doctors and nurses and other paramedics in the hospitals are also doing a great job under great amount of risk to their own personal health. Also, they are leading from the front. They are facing a lot of difficulties also. People are stigmatizing, people are ostracizing, but nobody has left the battlefield. Everybody wants to contribute for winning this war. So I don't want to elaborate upon what you have to do. You already have so much of experience. Whatever I have learned in the last 25 years, all my learning is after seeing all of you working in the field. And for me, each one of you has been a great teacher. And right now, the whole country is looking at all of you, because what we will be able to do in the field, that's going to be very crucial. And there also, the next 2 to 3 weeks are going to be the most crucial in handling the COVID-19 pandemic, particularly in India. You all know that we had our last foreign traveler, whether an Indian or a foreigner, on 23rd of March. After that, we had 2 unfortunate incidents happening because of migrant laborers at one point of time, and then another one in a mosque in Delhi. But we don't want to get into the postmortem of all that. We rose to the occasion, and immediately with the highest level of contact tracing, we traced thousands of people all over the country. We know we got unfortunately adversely affected in over 20 states of the country, but we don't want to look back. I am sure that if we can do a good job in the next 2-3 weeks in these containment strategies, visiting house to house, reporting back to us, reporting back to your relevant officials in WHO, helping the surveillance officers of the IDSP and the rapid response teams made with the help of the medical college people and the state governments, we should be able to handle this. I was very happy to hear the secretaries from Maharashtra, Karnataka, and of course finally Bihar. We know Bihar is not in so much of trouble right now, but definitely Maharashtra is in a bit of trouble, more particularly Mumbai, and then also Karnataka. But I was happy to see the confidence of all the 3 secretaries, and more particularly when Maharashtra said with confidence that we will take care of it. So I think it gave me a great relief. 2 specific things were asked. How do we calculate how many cases? I don't think anybody can calculate. Personally, I strongly feel that all these mathematical models are not going to work. I know I was given many mathematical models in the month of March. A lot of people came and delivered lectures and interviews on televisions during the last 30 days, predicting huge, disastrous consequences in India by such and such date. Fortunately for us, whatever those mathematical models predicted, they did not hold true. But even then, my answer to all this, you see the very fact that we are preparing ourselves for the worst. We are preparing for hundreds and thousands of COVID hospitals and ICU beds and ventilators and managing the PPEs and all those things in big numbers. I feel so proud of my virologists and the pathologists and the doctors running these laboratories. It was not long back when we used to send our swab or sample for virology tests to America. And in the first week of January, we had one single lab, the National Institute of Virology, competent enough to do this test. Today, I feel so happy that we have in the public sector itself, in our government also, government only, we have over 166 labs now. We have already done 2.5 lakh tests. Every day testing between 15,000 to 20,000 tests. In spite of all this, we are still not utilizing our full capacity. We have revised our testing guidelines, and now every patient with fever and running nose, he has to be tested within 7 days. And we are also expanding the network of laboratories further. We have involved the private sector. We have there also another 65 to 70 labs with 16,000 collection centers. And we have asked all our All India institutes and other big institutions in the country to become nodal points for collaborating and coordinating and motivating all the medical colleges in the country to have the facility in the next couple of weeks, wherever possible. And the Government of India has already helped the states in a big way. We have helped you we have given you leverage to use money through National Health Mission, also through the disaster management relief funds, and also special packages have been given to the states. Over 4,100 crores have already been given to the states. So we have given enough of provisions for helping the setting up of not only these labs but so many other things wherever if you need something. So it's by the end of May, our target is that we should be having a capacity of testing at least 1 lakh of patients per day. But if we are creating this capacity, it doesn't mean that we are imagining that number. But to the secretaries who posed this question, I think Maharashtra secretary probably posed this question, that what should we, or maybe the Bihar secretary, I think we have to be prepared for the worst and keep your, you see, we say the surgeon should have a eagle's eye. So now for us, these hotspots and the cases who are getting infected, we have to keep a very, very close watch on them. We have to ensure that the principles of lockdown, the guidelines of lockdown, the guidelines of social distancing, or now called the physical distancing, different terminologies are being used, they are very sincerely followed. In my science ministry, we have started simultaneously working for the development of the vaccine. We are thankful to WHO. We are also part of the WHO Solidarity Trial. We have also, like 4 or 5 other countries, isolated the virus. We are working on various aspects in our science ministries. And I am sure that together we will be able to overcome this particular issue. After all, it's a virus, we really don't know how is it going to behave. But in our ministry, we have started doing the genetic sequencing of the virus also, like we used to do about the polio virus during the fag end of the polio eradication movement in India, when we used to try to locate from where did this virus arrive in such and such district. So it's like a history being repeated for coronavirus. Maybe polio was something about which we knew. There was an international pledge, international WHO 1980 pledge of the World Health Assembly. Here we probably don't know much, but I am sure that with joint efforts we'll be able to defeat the virus, and we should be able to save as many lives as possible, and that will certainly require the services of my surveillance corona warriors working in the field, whether they belong to the IDSP or whether they belong to the state governments, rapid response teams or WHO. So I would use this occasion to wish you all good luck, and with lot of hopes from all of you that you will rise to the occasion. You are already doing it. You will live up to the expectations that the country has from you. Our Prime Minister also conveys his good wishes and blessings to all those people working in the field. Thank you so much. We will keep in touch. Any one of you can also pass on any message. You will be doing it to your officials, but you can feel free to convey anything to Dr. Harshvardhan also directly, either through a telephone call or through a message, because each and every bit of information is very important for us, and we don't want any information at any level of any nature should remain unattended by the system. So with these few words, I had made a preparation, this presentation, but I thought that since we are already running out of time, so I gave up the idea of this slide presentation and just spoke to you like this. Maybe we will share the slide presentations with the help of WHO to all of you who are our warriors in the field. Wish you all good luck. Thank you once again, WHO, and especially Dr. Poonam Khetapal Singh and Dr. Hank for helping us in organizing this meeting. Thank you.
For your sharing your vision, your blessings, and for the words of encouragement that you have given, reminding the field staff of their ability, calling them the surveillance corona warriors, informing us of the highest level of political commitment and engagement for this war that we are waging against this virus, and urging the field staff to put their heart and soul into this movement. Thank you very much, sir, for those words. And we would like to close the meeting, but before we do that, I would invite Dr. Ashish Satapathy, the team leader for Southern region of WHO India, to propose a vote of thanks. Over to you, Dr. Ashish Satapathy.
Good afternoon, everyone. It's a proud privilege to be part of this strategic discussions today. On behalf of WHO India field staff, I extend our gratitude to the dignitaries and the senior leadership. I would like to express our collective appreciation and deep sense of admiration to His Excellency the Honorable Health Minister of India, Dr. Harshvardhan Ji, for sharing with us his and Honorable Prime Minister's vision for the fight against COVID-19 and providing us valuable guidance. Sir, we only remember your leadership during the fight against polio. Today you have redesignated us as Corona Warriors. Thank you again for this first and extending this opportunity to WHO to join this battle against COVID-19 with Ministry of Health. We are enthused by the presence of Honorable Minister of State for Health and Family Affairs, Sri Ashwin Kumar Chaudhary. Thank you, sir, for your esteemed presence and kind support. Our Regional Director, Dr. Poonam Khetapal Singh, has always been a source of inspiration and a pillar of strength for all of us in the field. We thank her and express our gratitude for her bold leadership, valuable guidance, and never ceasing support to the field. Our sincere gratitude and heartfelt thanks again to our WR Dr. Hen Katkeda for guiding us in every step in this battle against COVID-19 and beyond. Sir, we always bank on your experience and wisdom. Thank you always for standing with the field and supporting us and guiding us. I take this opportunity to thank Special Secretary Health Sri Sanjeev Kumar Sir, DGICMR Dr. Balram Bhargav, Joint Secretary Sri Love Agrawal, Director NCDC Dr. Sujit Singh, and other senior officials from Health Ministry for the support to WHO and continued guidance. Support from Additional Chief Secretaries and Principal Secretaries of Health, Mission Directors, State Surveillance Officers from IDSP, and other senior state officials has been instrumental for our efficient functioning in the field, and we gratefully acknowledge this support. In addition, special thanks to Additional Chief Secretary and Secretary from Maharashtra, Bihar and Karnataka for enlightening us with the experience and lessons learned from the field. Senior officials and cluster leads from WHO CRO, WHO India office have also joined this celebration. We would like to express our admiration for their continued support. I would also like to acknowledge the presence of our colleagues from the field, the Corona warriors from National Public Health Surveillance Project, consultants from the National TB Elimination Project, officers from India Hypertension Control Initiative, and officers from the neglected tropical diseases. We are in this together, and we will try to win this battle. On behalf of the field team, we assure you of our strongest possible support and commitment to this cause. We pledge to work cohesively with the state leadership and take this collaboration forward. Thank you very much.
Thank you very much, Dr. Satapathy, and we echo your thanks to all the participants of the meeting today, and especially to the Honorable Health Minister, Dr. Harshvardhan, and the Regional Director of WHO Southeast Asia Region, Dr. Poonam Khetrapal Singh, and bring this meeting to a close. Thank you all very much.